Hello, everyone. Welcome back to another day of our NCLEX review, and we are on day 64 out of the 90 days. So for those who are new to the channel, you are welcome to stay with us all throughout this session, and we are thanking for those who are regular attendees. We are also encouraging you to enroll into our NCLEX course via the website at www.stancoastnclexcoaching.com. And we have updated our library of recorded videos as well as the animated video series. We also have the 3,000 NCLEX style questions and 20 hours of animated videos for flexible study. And we also want to make sure that your confidence is boosted before you're going to take the examination. Now, for additional details, you can click the description box below, and we always follow your feedbacks. They're valuable to us, so kindly share your thoughts or questions in the comments, and we'll gladly assist you. Now, don't forget to subscribe, like, and share this video with your friends, and make sure that you'll be spreading the word as well. So this can help us with our new channel. Now, today we'll be doing some exercises about the medications used for the peripheral nervous system. So let's get started right away. So we have our first question, which is on Bethanical. This is a medication ordered for a patient after surgery who is experiencing urinary retention. Before administering this medication, the nurse reviews the patient's medical history. Which condition would be a reason to avoid using this medication? Is it A, history of asthma during childhood, B, presence of GERD or GERD, or the gastroesophageal reflux disease? We have letter C is diagnosis of high blood pressure, and D, existing low thyroid function. Now, take your option. This is on a medication called Bethanical for a patient who is experiencing urinary retention, a patient that is post-op. So the question here is, which condition would be a reason to avoid using this medication? So take your pick. While you're going to do that, I'm going to start rationalizing all these options. So let me start with letter D this time. Existing low thyroid function. Do you think that this would be a contraindication to taking this medication? Low thyroid function or hypothyroidism. We know that the Bethanical can cause the dysrhythmias, right? Especially in a person with hyperthyroidism. But there is no known adverse effect on patients with hypothyroidism, so making it safe to use in such a case. So here we have a patient. The option in letter D is not a contraindication. However, if the case is hyperthyroidism, then that's something that you should be cautious about because the Bethanical can cause the dysrhythmias. So hyperthyroidism and the use of Bethanical would not be a good mix. Bethanical or the uricolin, it will cause the dysrhythmias. Bethanical. So you got to be cautious when administering this medication and make sure that you have gathered enough information about their medical history. Now let's move on to letter C, diagnosis of high blood pressure. Will this be a condition that you should consider especially? Will this be a contraindication to the use of Bethanical? We know that this can lead to the following contraindication. I mean, the diagnosis of high blood pressure specifically is not really a contraindication as well, as we know that it is going to affect mostly in the bladder function and also the bowel function. So what do you think about letter C? We know that the botanical can lead to a vasodilation, right? So please take note of that. Botanical can cause vasodilation. So in a case with a high blood pressure, do you think this is going to be a contraindication? Well, that is incorrect, as we know that it can actually lower the blood pressure rather than exacerbating the hypertension. So it's not a contraindication for this case. What about letter B? Presence of gastroesophageal reflux disease or GERD. You think this is a contraindication? Well, the botanical or uricolin can increase the GI motility, the peristalsis, and also the secretion, which could theoretically can worsen the GERD, but it is not going to be a contraindication. It does not have a direct effect that would outweigh its benefits in treating the urinary retention. So this is not going to contraindicate the use of this medication. Not a contraindication, so we are eliminating that one. What about letter A? History of asthma during childhood. We don't have any other choice but letter A, right? As we know that this medication is actually going to cause the, it can stimulate the muscarinic receptors in the lungs. It can lead to bronchoconstriction or bronchospasm. So this would be our correct answer. It can stimulate the muscarinic receptors, leading into the bronchoconstriction. So this would be our contraindication for this medication. So take note, guys, about the muscarinic receptors. I don't know if you still recall those receptor locations. Well, the following are the sweat glands. Please take note. Specifically, muscarinic receptors. These include your sweat glands. We also have the blood vessels. And the other organs of the body that is regulated by the parasympathetic nervous system. So specifically here, the medication is going to increase the tone of the urinary bladder. That is the target organ for this medication. It can cause the contraction of the detrusor muscle. It can also enhance the bladder emptying. And so it will be beneficial in treating this patient with a urinary retention. Now, it can also stimulate the peristalsis. It will increase the motility of the GI tract and also the organs involved. And it will also stimulate the secretion of the saliva in the patient. So the muscarinic medications or muscarinic agonists, they are actually going to alleviate, they will treat the mouth dryness. So again, our botanical is what we call as the muscarinic agonist. So it has the exact opposite of the anticholinergic atropine. Alrighty, guys, let's move on to the next test question. We have item number 2. A patient with overactive bladder or OAB is starting treatment with a transdermal muscarinic antagonist patch. During patient education, the nurse explains how to handle side effects. Which statement by the patient suggests they need more guidance? Is it A, I can use sugar-free gum to help with a dry mouth? B, laxatives might be necessary if I get constipated? C, keeping the patch covered will prevent others from exposure to the medication? D, I'll use Benadryl if the patch causes local itching. So we are talking about a patient that has an overactive bladder, and your treatment includes the application of a transdermal muscarinic antagonist patch. So this is the exact opposite of that medication that we talked about in the first item. Here, this is a muscarinic antagonist, whereas the botanical is the muscarinic agonist. So the question here is, which statement by the patient suggests they need more guidance? Is it A, B, C, or D? Well, you are answering. I'm going to start rationalizing. So for your letter A, I can use a sugar-free gum to help with a dry mouth. This is an incorrect answer because the sugar-free gum actually will stimulate the saliva production. And the question here is asking you to select that item that will signify a statement that would require guidance. So letter A in itself, I can use sugar-free gum to help with a dry mouth. This is a good statement from the patient. What we are looking for this time is a negative statement. So we are gonna take this away. What about letter B? Laxatives might be necessary if I get constipated. This is also an incorrect statement because the muscarinic antagonist can cause constipation. And so if the patient has this condition, they will be advised to use laxative, or they need to be increasing their fiber in the diet as well. So we are eliminating this one. What about letter C? Keeping the patch covered will prevent others from exposure to the medication. Is there such a precautionary measure that should be followed? Is that something that is known to this medication? Well, this is incorrect as well because the transdermal patch, it can transfer to others through contact, but keeping the patch covered is a preventive measure against this. Okay, so this is basically a preventive measure to prevent the others from getting into contact with a medication. So keeping the patch covered is going to be a correct statement. It's a positive statement that you should not pick in this situation. We are picking that incorrect statement, which is letter D. I'll use Benadryl if the patch causes local itching. Why? As we know that Benadryl has an anticholinergic effect, and if the patient is already using a transdermal muscarinic antagonist, this is also going to really cause dryness. It can cause a decreased oral secretion. And aside from that, this medication also will enhance the side effect of the Benadryl. It can lead to more constipation, dryness of the mouth, and urinary retention. So Benadryl has anticholinergic effect. It's not really an anticholinergic, but it has anticholinergic properties. So with this medication, when used with a patch, this can lead to the oral dryness. There's also urinary retention and constipation, as we know that this can reduce the peristaltic movement in the GI tract. So the correct answer here will be letter D. So you're going to pick that option that actually will aggravate the situation, or it can cause more similar effect to the medication. All right. It can amplify the effects of the muscarinic antagonist patch. Let's move on to number 3 this time. When a patient is given topical atropine for an eye exam, the nurse advises them to stay in a dimly lit room or wear sunglasses afterwards. This advice is based on the knowledge that muscarinic antagonists cause A. Increased pressure inside the eye, B. Pupil constriction and ciliary muscle contraction, C. Iris sphincter muscle paralysis, and D. Relaxation of the ciliary muscles. Take your pick. A patient that is given that atropine for the eye exam. So this is what the nurse advised them to do. They're going to need to stay in a dimly lit room, or they should be wearing glasses, or sunglasses rather. So what is really the reason why the patient has to go by the nurse's recommendation? Will it cause letter A, or B, C, or is the principle similar to A, B, C, or D? Now let's have letter A this time. Increased pressure inside the eye. What is that? This is incorrect, because while the atropine can cause an increase in the intraocular pressure, which is actually can be worsened, which can worsen the glaucoma itself, but this is not the primary reason why they should avoid the bright light after the treatment. So we're going to put that as a not primary reason. It can increase IOP. However, following the nurse's recommendation is not really intended about avoiding the IOP increase in this patient. So let's have letter B instead. Pupil constriction and ciliary muscle contraction. Would that be the explanation? This is also incorrect, because the atropine can actually cause the pupil dilation, not constriction. So this is a false statement already. You automatically take this one away. It is not meiosis, but it can cause the mydriasis, or the pupillary dilation. So take note, guys. Atropine can cause mydriasis, or the dilation of the pupils, not constriction. The atropine is intended to be used as a pre-procedure medication in order for the ophthalmologist to look into detail the internal structures of the eye, that pupillary dilation. So we are going to eliminate letter B as well. What about letter C? Iris sphincter muscle paralysis. Is that the principle? Well, that is the correct answer, as we know that the atropine blocks the muscarinic receptors. It can cause the paralysis of the iris sphincter. And again, it can prevent the pupil from constricting in bright light. So when the patient has the atropine sulfate as an eye drop, even after the procedure for a few hours, it can cause that dilation. It can cause the photophobia. So take note about its side effect due to the pupillary dilation. And that is the correct answer we have. What about letter D? Relaxation of the ciliary muscles. Would that be it? Although the atropine can relax the ciliary muscles, affecting the accommodation of for the near vision, it is not the primary reason for advising this patient to stay in a dimly lit room, or why they should be wearing the sunglasses post-procedure. not the primary reason. So we have our answer this time, which is letter C, iris sphincter muscle, ciliary muscle, iris sphincter muscle paralysis, rather. So let's do a quick review regarding the use of the atropine drops for this eye examination. So what we should be doing, what you should instruct to your patient after you had assisted the ophthalmologist in this procedure. Well, you got to make sure that they're aware about the common side effects that they will encounter. They're going to have blurring of the vision. That is one. Also, photophobia. It is going to be really excruciatingly sensitive. I mean, the patient who will be getting the atropine sulfate, when they're going to expose themselves under the sun, it is really blinding. The photosensitivity is so pronounced this time because of the pupillary dilation. Photophobia. And I actually tried this for myself. It's no joke. The patient will also have some dry mouth and also dry eyes. So make sure that this is going to be shared to your patient. You should educate them before they're gonna have the medication, so they are aware specifically about what should be taken into consideration after the procedure. They should be wearing the sunglasses to protect against the light sensitivity until the effects of the drug can wear off. And they should not drive or operate any machinery until their vision returns to normal. And usually the dilation can last for about good 2 to 4 hours. And that was the same kind of duration that I had. And they're going to be fall risk as well. So make sure that this is something that you should consider, especially if this is a procedure that is done in a patient that is admitted to the hospital. Make sure that there's supposed to be some assistance to this patient getting this medication. Let's proceed with number 4 this time. A patient with hypertension is prescribed clonidine or the catapres. During education about the medication, which statement by the patient indicates they understand the potential side effects? Is it A, chewing sugar-free gum or drinking water can help my dry mouth? B, driving is not safe while taking this medication. C, I should stand up slowly to avoid feeling dizzy. And letter D, if I feel anxious or depressed, I should stop the medication immediately. So your patient is prescribed with the clonidine for the high blood pressure. But during the education about this medication, you're going to assess if they understood the teaching regarding the side effects of this medication. Will that be letter A? Would that be B? Or C? Or is it letter D? We're talking about clonidine. So I want you to recall what this medication is about, its drug classification, and the common side effects. So let me get started here with letter D. If I feel anxious or depressed, I should stop the medication immediately. Will that be a wise statement coming from the patient? As we know that, especially when a medication has been taken for quite some time, immediately stopping the medication can lead to rebound hypertension. And this is something that should not be done by the patient. Rebound hypertension. So it doesn't reflect understanding about the side effect of the medication and also the entirety of the education. So this is a wrong statement. What about letter C? I should stand up slowly to avoid feeling dizzy. What do you think about this one? Is this a medication that can lead to orthostatic hypotension? Well, we know that this is an antihypertensive medication, but this is a drug that is not going to cause a whole lot of orthostatic hypotension because the effect of the medication is not dependent on the patient's posture. So the dizziness upon standing is unlikely to be a prominent issue in this patient taking the clonidine cataprist. The orthostatic hypotension is more common with the beta blockers, the ACE inhibitors, hydralazine, but not with clonidine cataprist. It's not really a common occurrence. So we are eliminating letter C as well. How about letter B? Driving is not safe while taking this medication. Driving is not safe while taking this medication. Well, the statement is somewhat kind of general right here. Driving is not safe. As we know that the drug can cause drowsiness. We know that. However, this side effect is not permanent. This is something that can diminish over time. And so advising the patient to avoid driving initially or when they are feeling drowsy is prudent. But again, this is not a permanent restriction. So we are going to eliminate this one as well. Now, what about letter A? Chewing sugar-free gum or drinking water can help my dry mouth. This is a correct response, a correct statement from the patient, because the drug itself can lead to xerostomia, which is the dry mouth. And this is not temporary, but this is a side effect that will occur all throughout the medication therapy. So if they are telling you that they can chew a sugar-free gum or they will take frequent sips of water, can really mitigate this discomfort. So we are going to pick letter A this time. So again, guys, to wrap this up, the medication cataprist, it is going to cause the dry mouth and can be easily mitigated by chewing a sugarless candy or gum, and they can take sips of water. Although this is going to cause some dizziness, but it's not a permanent side effect. This is something that the patient will be able to get used to. Initially, they should avoid driving, but somehow this side effect will diminish so they can resume driving again once they will have diminished side effect of the drug. And this is a medication that does not usually cause the orthostatic hypotension. This patient telling you that they should abruptly stop taking the medication is unwise. This will lead to the rebound hypertension. Now, if you can recall the classification of the drug, this is basically what we call as the centrally acting centrally acting alpha adrenergic agonist. So how is this medication going to work in reducing the blood pressure? Well, this is going to reduce the sympathetic outflow from the central nervous system, which will lead to a reduced peripheral resistance. So the mechanism is basically to reduce sympathetic outflow from the central nervous system. And so the patient will have eventually a decrease in the peripheral vascular resistance, also a decrease in the heart rate and the blood pressure. Okay. And it's also used with several other conditions. It could be used in a patient that may have the ADHD as well. It can be used for pain management. And this is not a surprise. This is an adjunctive therapy for those patients that may have severe pain, particularly those with a neuropathic type of pain. And this can be administered together with those analgesic drugs. All right. Now, we're going to talk about the next question here, number 5. A patient on clonidine for high blood pressure reports feeling drowsy. What is the most appropriate response by the nurse? Is it A, feeling sleepy is common at first but should decrease over time? Or is it B, you might also experience dizziness from low blood pressure? C, CNS side effects like this could lead to addiction? Or D, stop taking the medication and notify your healthcare provider. So the patient is taking the clonidine, right? But now is reporting feeling drowsy. So as the nurse to this patient, what would be your appropriate response? Is it A, B, C, or D? So if you had answered letter D this time, stop taking the medication and notify your healthcare provider. As we know that discontinuing the clonidine abruptly can lead to what? This is going to lead to rebound hypertension. So you should not select letter D. Rebound hypertension, or HTN. What about letter C? CNS side effects like this could lead to addiction. Will that be the subsequent effect? No, that is incorrect. We know that the clonidine can affect the central nervous system, but it does not have a high risk for addiction. The primary concern in this question is to manage the sedative effects without undue harm. So we are not going to pick letter C. Let's have letter B. You might also experience dizziness from low blood pressure. Is that true? As we know, guys, that the dizziness that is going to be caused by the clonidine is not related to the posture, as I have said earlier. It is not related to the patient's posture. And so the orthostatic hypotension is less likely compared to other antihypertensives. So the dizziness is not a common occurrence due to the posture of the patient. It isn't. It's not on the orthostatic hypotension. It is more related to other antihypertensive drugs. So if you had answered letter A, feeling sleepy is common at first but should decrease over time. Remember what I've said about the previous test item on that patient that is supposed to drive? This is the initial side effect of the clonidine that will become less intense with continued use. So just informing them about the side effect that is temporary can help them manage more about their expectations. So they will not have misconception about the use of this medication. This is a temporary side effect. So the correct answer is letter A. Number 6. But before we're going to proceed with this, I'm inviting you again to enroll in our NCLEX course via Stancoast, NCLEXcoaching.com, and also click in the description box below for that link. Number 6. When explaining methyl-dopa's pharmacology to nursing students, which student statement shows need for further clarification? Is it A, methyl-dopa isn't an alpha-2 agonist by itself, but activates them? Letter B, the drug requires conversion to an active form to work. Letter C, it lowers blood pressure by decreasing the heart's pumping strength. Letter D, the main action is expanding blood vessels, not decreasing heart activity. The question is asking you to pick that statement that shows a need for further clarification. Statement that signifies misunderstanding about the methyl-dopa. So if you had answered letter A this time, guys, methyl dopa isn't alpha 2 agonist by itself, but activates them. This is an incorrect option. Why? Because the drug itself is inactive. When it is taken, it is inactive as an alpha 2 agonist. But once it is ingested, or if upon entering into the body, this is going to be metabolized into the form methyl norepinephrine. So this is the converted form, methyl norepinephrine. Again, methyl dopa is inactive before taking, but once it is ingested, it will be metabolized by the body, of course. It will be converted into an active form. And this is going to be taken by the brain, which will then act on the alpha 2 receptors. All right? Alpha 2 receptors of the brain. And then this will reduce the sympathetic outflow. So this is the correct description of the conversion, basically from methyl dopa to methyl norepinephrine is the correct sequence in the event of this medication. And so if you answered letter A, methyl dopa isn't an alpha 2 agonist. This is what makes this statement false. Actually, this is a statement that is actually correct. Sorry. Let me remove that one. It is a correct statement. So we are going to disregard this one. We are looking for that incorrect statement. What about letter B? The drug requires conversion to active form to work. The same thing, right? It is to be converted. It has to be metabolized first into the methyl norepinephrine form. So this is also incorrect. This is a correct statement. What about letter C? It lowers blood pressure by decreasing the heart's pumping strength. Pumping strength. So this is talking about the cardiac output, which is basically not going to be influenced by the methyl dopa. Cardiac output is not influenced by this drug. And so we are going to select this answer. It does not reduce the blood pressure of the patient by affecting the cardiac output. It lowers blood pressure by decreasing the heart's pumping strength. It really doesn't do that kind of mechanism. Okay? The medication in itself works by the effect of the drug in the alpha 2 receptors in the brain, which will lead to the decrease in the sympathetic outflow, which will lead to the vasodilation. But it doesn't influence the patient's contraction of the heart. It is not the mechanism that is correct. What about letter D? The main action is expanding blood vessels, not decreasing heart activity. As I have said, the medication can work on the alpha 2 receptors of the brain. It can reduce the sympathetic outflow, causing a decrease in the peripheral vascular resistance. So it can lead to the vasodilation. It does not decrease the heart activity. I'm talking about the pumping action of the heart. So this is also an incorrect option. So here we go. We have our correct answer for this item, which is letter C. That is the incorrect statement by the student that needs to be corrected. Let's have number 7. A patient using clonidine for several weeks reports feeling sleepy and experiencing constipation. How should the nurse respond? Is it A, try taking most of your medication at night to minimize daytime drowsiness? B, You should ask your doctor if a skin patch might be better for you. Or is it letter C? It's possible you are taking too much of the medication. Or is it D? Stop the medication and contact your doctor immediately. Take your pick. Now, if you had answered letter D, stop the medication and contact your doctor immediately. As we have talked earlier about the side effect of the medication, it will cause drowsiness, right? Not dizziness. So if the advice is to stop taking the drug and calling the doctor immediately, that doesn't make any sense, as we know that stopping the medication immediately can cause the rebound hypertension, which is very dangerous for this patient. And they should not alter any of that medication regimen after. They can only do that once they have contacted their healthcare provider. This is wrong advice. What about letter C? It's possible you are taking too much of the medication. Is it really about overdosage? No. We know that the clonidine can already cause the drowsiness. It can have that sedative effect. It can lead to that sleepiness. So if the statement is saying if it's possible you are taking too much of the medication, well, it doesn't really jive with the statement of the patient telling him that they are feeling sleepy and experiencing constipation. These are side effects of the drug. However, if the patient has overdose, that's a totally different story. When they're going to take way too much of the clonidine, they're going to have a severe CNS depression, not drowsiness, if they are overdosing on it. Okay? So we are going to eliminate letter C as well. What about letter B? You should ask your doctor if a skin patch might be better for you. Well, we know that the skin patch is just an alternative form or route for the oral catapress. The medication will still give a much more steadier release of the drug into the patient's skin. It will not reduce the side effects like the drowsiness or constipation. So it doesn't address the patient's concern. What about letter A? Try taking most of your medication at night to minimize daytime drowsiness. Again, guys, remember about the temporary side effect? Yes, it is temporary. So during the early phase of the therapy, it is advisable to actually have this patient take the medication at nighttime to mitigate the daytime drowsiness. All right. And constipation is also common, and this can be managed with dietary modification as well. It is easily treated. But regarding the patient's drowsiness, this is something that we can easily fix by advising them to take the drug at nighttime. So the correct answer is letter A. Let's have number 8. A patient with pheochromocytoma is scheduled for surgery and is prescribed an alpha blocker, which is the phenoxybenzamine, known as the dibenzylene. What is the nurse's understanding of the purpose of this medication? Is it A, it helps prevent a severe increase in blood pressure during surgery? Is it B, it stops the tumor from releasing stress hormones? Or is it C, it reduces muscle contractions in the adrenal gland? Or is it D, it is continued after surgery to control blood pressure long term? The question is, what is the nurse's understanding of the purpose of this medication? So the patient has a diagnosis of pheochromocytoma and is going to be scheduled for surgery. So before the surgery, they're going to take this alpha blocker, phenoxybenzamine, or the dibenzyline. What is the reason why they should be taking this drug? Is it A, B, C, or D? Let me have letter D first. If you answered letter D, it is continued after surgery to control blood pressure long term. That is an incorrect option, as we know that alpha blockers are typically used in the preoperative or the perioperative period for the pheochromocytoma in order to manage the acute hypertensive risk. And so when it's stated long term, well, the long-term use post-surgery of this medication is not standard unless the tumor is not operable or there are other conditions that would necessitate it. So this is not really a correct statement. It is not indicated for long-term use. What about letter C? It reduces muscle contractions in the adrenal gland. Will it prevent that? Reduces muscle contractions? We know that the medication can act on the vascular smooth muscle, which is the middle layer of the artery, but not directly on the adrenal gland tissue. It is not going to prevent that. There is no such thing as reducing muscle contractions of the adrenal gland. The alpha blockers instead can prevent the excessive vascular contraction or the constriction. It doesn't have a direct effect on the glandular tissue. What about letter B? It stops the tumor from releasing stress hormones. Is that the desired effect of the drug? It is also incorrect. It will not prevent the catecholamine release by the adrenal medulla. What can work here is that they are going to inhibit the receptor activation. So the medication in itself will block the effects of the norepinephrine and epinephrine. It does not stop the hormone release. Blocks the receptors of norepinephrine and epinephrine. It does not block the secretion of the adrenal medulla. Does not block secretion of the adrenal medulla. So this is going to be incorrect. I'm pertaining to letter B. So the correct answer here is letter A. It helps prevent a severe increase in the blood pressure during surgery. That is the therapeutic effect of the drug, the reason why it has to be taken days before the intended surgical procedure. As we know that the pheochromocytoma, this is an abnormality. There is excessive release of those catecholamines, norepinephrine, epinephrine, especially when it is manipulated during the surgical procedure. When it is going to be manipulated, it can precipitate hypertensive crisis. And so it's very important that the patient has taken this drug already days before the surgical procedure. So our correct answer here is letter A. Now let's move forward to our next item, number 9. A patient with type 1 diabetes is on NPH daily, 30 units, and also taking metoprolol loprezor. What should the nurse emphasize during education? Is A, metoprolol doesn't affect your diabetes or insulin needs. B, metoprolol can reduce insulin effectiveness, so you may need more. Letter C, metoprolol might hide low blood sugar signs, so check your levels often. Letter D, Metoprolol might increase insulin's effect, so you may need less. So take note, this is a case of a diabetic patient, type 1, using insulin, NPH insulin 30 units, and also taking metoprolol. So what you should emphasize in educating this patient? Is it A, B, C, or D? Let me have letter A first. Metoprolol doesn't affect your diabetes or insulin needs. This is incorrect, as we know that the metoprolol can mask symptoms of hypoglycemia. Take note, metoprolol plus NPH insulin or any kind of insulin, any oral hypoglycemic agents, it can mask the hypoglycemia. Masking of hypoglycemia. So what do you think are those manifestations that are supposed to be detected in a regular patient taking just the NPH insulin? Well, especially that they are taking metoprolol, which can decrease the heart rate. Remember, this is a beta blocker that can reduce the heart rate. So supposedly when a patient has hypoglycemia, not taking metoprolol, what they will usually have will be tachycardia, which is a sign of hypoglycemia. However, when they are taking this insulin, this can possibly lead to hypoglycemia, right? Alone, just the NPH. However, if they are going to take metoprolol with it, the patient will not have tachycardia this time because of the drug itself, right? So this is going to be a lot harder for us to detect the low blood sugar levels. And it does indirectly affect the diabetes management by hiding this warning signs. So, bradycardia will occur in this patient. So instead of assessing this patient for the low glucose, such as tachycardia sign, it's no longer expected finding of this patient because of the beta blocker itself. So we are going to eliminate letter A. What about letter B? Metoprolol can reduce insulin effectiveness so you may need more. Can reduce insulin effectiveness? Does it have that effect? No, it does not decrease the insulin's effectiveness. Rather, it can make recognizing the hypoglycemia much more difficult. So we are going to eliminate this one as well. What about letter C? Metoprolol might hide low blood sugar signs, so you check your levels often. This is the correct statement that should be selected. That is letter C. It can mask the hypoglycemia, so this is very important for the patient to know that they should be checking their blood sugar often. What about letter D? Metoprolol might increase insulin's effect, so you may need less. That is an incorrect statement. It doesn't increase the insulin effect. It can only mask the hypoglycemia sign of your patient. There's no more tachycardia this time because the beta blocker can slow down the heart rate. Let's move along with number 10. A patient beginning treatment with an alpha blocker for high blood pressure shows understanding when stating, A, if my heart beats faster, I should stop the medication. B, I shouldn't drive while taking this medicine. C, I'll take the first dose before bed. Or D, I'll stop taking if I feel dizzy. So this is a case of a patient beginning treatment with an alpha blocker for the high blood pressure. And take note, guys, alpha blockers will prevent it will block the receptors from being stimulated by the norepinephrine and epinephrine. So we are talking about those receptors in the blood vessels. Alpha blocker. So which option are you going to pick here? If you had picked letter A, if my heart beats faster, I should stop the medication. This is a statement that is incorrect because an increased heart rate is a known side effect of an alpha blocker. Side effect. Expected side effect of alpha blocker. Again, your patient will end up with tachycardia, and this is not the reason to stop the treatment unless the tachycardia is severe. Okay? The statement here, if my heart beats faster, I should stop the medication. This is not requiring an immediate stop. However, if the statement said severe, rapid beat, then that's totally different case, right? So we are going to eliminate that one. What about letter B? I shouldn't drive while taking this medication. Shouldn't drive. Like I've said earlier about the alpha blockers, they can cause the dizziness, the drowsiness. It can happen during the initial dose. However, the driving is generally safe after the first 24 hours. This is not a permanent side effect of the medication. It is a temporary side effect that is expected, and so they should refrain driving during the first intake of the drug. However, following that episode, they can resume driving. Okay? The teaching here should be to let them know that the initial side effect can happen during the first intake. However, this will diminish after that episode. So we are going to eliminate letter B as well. Take a look into letter C. I'll take the first dose before bed. Yes, as I've said earlier, this is going to reduce the side effect of the drug, that sleepiness. Take note of this one. They should be taking this drug, especially during the initial stages. Take this at nighttime to reduce the drowsiness effect of the medication. Okay? So we are going to select letter C this time. And what about letter D? I'll stop taking if I feel dizzy. Well, this is not really the correct answer that we are looking for. This is a medication that can lead to the drowsiness during the earlier stages, and the medication should not be stopped because this can lead to that rebound hypertension. All right, let's have number 11. I guess we still have a few minutes left. A nurse is about to give propranolol or Enroll to a patient who has just had a heart attack. The patient's heart rate is 52 beats per minute and the rhythm is regular. What should the nurse do next? A, give the medication as ordered. B, ask for an order for atropine. C, hold the medication and note the heart rate in the patient's record. D, do not give the medication and inform the prescribing doctor. So you are about to medicate the patient with Enroll who just had a heart attack. And the patient's heart rate is 52 beats per minute. Their rhythm is regular. What you should do initially? Will that be A, B, C, or D? If you had answered letter A, give the medication as ordered, are you supposed to give it? Since the medications, I mean, the effect of the drug here, I mean, the patient's heart rate is already bradycardic, 52 beats per minute. That is less than the 60 beats per minute cutoff. So if you're going to give the drug, it can further lower the heart rate and could lead to some more bradycardia to the patient, and it can cause some more complications. So you should not be doing letter A this time. The medication should be withheld, not given. Withheld, and you got to notify the MD. What about letter B? Ask for an order for atropine. Is this an appropriate action? We know that the patient getting the atropine, that is only indicated if the patient has symptomatic bradycardia. Okay? Atropine is only given if the patient is symptomatic. And we don't have that kind of information in this scenario. This is so premature in this case. What about letter C? Hold the medication and note the heart rate in the patient's record. Hold the medication. Is this an action that is enough? Is this sufficient? We know that holding the drug is correct and also documenting the heart rate. But if there is no notification to the provider, the nursing action is so incomplete. And so this is not a safe practice, not the best practice to do. Now, let's move forward with letter D. Do not give the medication and inform the prescribing doctor, right? So this is the best answer that you should be selecting. You should hold the propranolol when the heart rate is below 60, and you're going to notify the medical provider. The intent to call them is to make sure that you have discussed with the medical provider whether to continue, or maybe there's a need to adjust the dose, or maybe stop the medication. And so this is something that you should do when you are informing the medical provider. What would be the safe next steps once the patient has the bradycardia when they're supposed to be taking the Enroll? So it is very important, guys, that you should emphasize collaboration when you are dealing with this kind of scenario. Make sure that you are notifying the medical provider right away, especially that the patient is developing bradycardia towards the propranolol. All right, so that's it for today. I hope that you are learning some regarding the pharmacotherapeutic agents used in the peripheral nervous system. We're going to have more pharmacology concepts tomorrow about the central nervous system. So thank you for your participation today, and you have a great day and take care. Be safe out there. Bye-bye.